गुड आफ्टरनून सर।
लेट आ गए।
हाँ जी सर। कुछ काम रह गया था घर पे सर, इसलिए आज लेट हो गई हूँ। कल सर आप ऑक्लूसल एडजस्टमेंट पे इतना आपने मुझे समझाया, मुझे थोड़ी बातें समझ आई, थोड़ी रह भी गई। और इतना आपने लेआउट करके उसे इतना सारा सामान, इतना इक्विपमेंट्स, इंस्ट्रूमेंट आप यूज़ करते हैं, तो ये सब जरूरी होता है ट्रीटमेंट के दौरान? इससे पहले तो मैंने किसी क्लिनिक पे इतना लेआउट करके सामान को नहीं देखा। इतनी तरह के आपने आर्टिकुलेटिंग पेपर्स यूज करते हैं।
वो इसलिए कभी आपके जूते में कोई कील चुभी क्या?
हाँ जी सर।
कैसा लगता होगा अगर कील अगर ना निकाला जाए तो?
पेन करेगी सर, वो चुभेगी।
और कैसा लगे मैं दूसरी कील निकाल दूं और जब चुभती हुई कील ना निकालूं तो?
उससे कोई फायदा थोड़ी ना होगा सर।
हाई पॉइंट को निकालने के लिए यू हैव टू बी वेरी सेंसिटिव टू आइडेंटिफाई इट. It is a irreversible process.
Okay.
If you can find the actual prematurity, treatment is like this. So simple. But if you have failed to identify it, like I always say, this is high point. And if you have not identified it and you have removed the other thing,
Yes,
so
yes.
this high point will increase.
Yes sir.
So I am very, very careful. It is my own experience. With the experience, you become more and more careful. Because it is an invasive, destructive process. You are removing the normal tooth structure. So you have to be very, very sensitive. You have to sensitize the patient.
वो ये सब जैसे आप हाई पॉइंट को देखने के लिए कई बार टूथ को रिड्यूस करते चले जाते हैं, तो उससे तो दांतों में सेंसिटिविटी हो जाती होगी।
That is why you have to be very selective in grinding. You have to take the informed consent of the patient. Otherwise, there will be a lot of mistake. And you will not be able to help the patient in any way, rather harm the patient. I don't want. The first principle of medicine is first do no harm to patient. If you cannot solve the problem, you don't create a problem.
आपकी ट्रीटमेंट से तो यही लगता है सर कि ऑक्लूसल एडजस्टमेंट के समय आपसे तो कोई मिस्टेक नहीं होती होगी।
मिस्टेक होती हैं, होती रही हैं, आगे भी होंगी। ये ना हो उसके लिए मैं बहुत केयरफुल हूँ. And there are many mistakes which I am aware, which I have done myself.
Which mistakes, sir?
Selecting the wrong patient.
Okay.
Selecting the wrong side, and wrong tooth, and wrong prematurity, and wrong cusp. Doing in a wrong time, without informing the patient, without taking his consent, doing haphazardly, illogically, without following a step, without following any principle, doing in traumatized tooth, doing occlusal adjustment in inflamed tooth, in fractured tooth.
इतनी सारी मिस्टेक्स हो सकती हैं सर?
It will create a problem. N number of mistakes will be created if you are not careful. It's just like driving. If you are not careful, what will happen?
Accident, sir?
And it's not one accident, many accidents. Again and again I am saying the teeth has to work in harmony with the other structure. The orthodontic treatment will not be successful if you don't reduce the occlusal prematurity. The endodontic treatment will not be successful. No treatment will be successful if you don't integrate your treatment with other structure. There is a proper need for harmonization of your treatment with the other structure. You may have done your best treatment, you may have put your best implant, but if you have not integrated your implant with the occlusal scheme, then you will get problem. It will be unstable, it will become loose. So irrational, untimely, illogical cutting of that a normal tooth structure, it will invite lot of problem. As you have rightly pointed out, tooth will become sensitive, it may be exposed, you may create more high points, and you may do the occlusal adjustment but incomplete. You have not found the other prematurity, and you have left the other prematurity. The patient will not be satisfied till all the prematurities are removed.
So what is this prematurity?
Prematurity which inhibit the upper and lower teeth to occlude prematurely.
Okay.
They will occlude like this. It's not occluding in intercuspation. It's not allowing the smooth glide, smooth slide laterally, anterior, posteriorly. Three-dimensionally it has to move. There should be freeway space, proper freeway space. The tooth, the jaw should rest in physiological rest position. There should be a vertical dimension. So if you have removed the wrong cusp, a wrong side, so you have reduced the vertical height.
Okay.
You have removed the stopper. You have removed the cuspal stopper. So you have, if you are not careful,
Okay, sir.
you will do harm. Like if you are not principled, you have not followed the Bull's law. You know Bull's law. If there is a prematurity, you have to reduce the buccal of upper and lingual of lower.
Okay, sir.
You can't reduce the other way around. So if you don't have the proper knowledge, without a proper comprehension of all the aspects of stomatogenetic system, you will invite more and more problem, and you will not be able to satisfy the patient.
Okay, sir.
So if you don't study the study cost, if you don't take the waxed restoration bite,
सर एक चीज और पूछी थी, फिजियोलॉजिकल occlusion and pathological occlusion, इनमें क्या डिफरेंट है सर?
physiological where allows any occlusion which allow all the function, biting, chewing, incising, gnashing, every mastication which allows the mastication physiological, it's a physiological occlusion. Pathological which does not allow, like any occlusion with prematurity, with traumatic occlusion. A traumatic occlusion is a pathological occlusion.
Okay, sir.
Any occlusion which create a trauma is a traumatic occlusion.
Okay.
Any occlusion which is not physiological will be pathological.
और सर ये प्राइमरी ट्रॉमा फ्रॉम occlusion and secondary trauma from occlusion क्या होता है?
Any prematurity in the normal dental structure is a primary trauma. Like there is a high point and it's creating problem.
Okay.
So it's a primary trauma from occlusion. But there is no high point, but teeth are loose. There is a periodontal bone loss.
Yes.
Teeth are migrating. Teeth are mobile. There is a pathological migration. So normal occlusal force will create a trauma from occlusion. Normal occlusion, there is no high point. But normal occlusal
तो
force,
उसके हाई पॉइंट नहीं था तब भी प्रॉब्लम क्रिएट हो गई.
that is secondary trauma from.
Okay.
Secondary trauma from occlusion will always have a pathology in the bone, in the periodontal stem. Why? In primary, there is no periodontal problem. There is no So if you don't have this understanding
Mm-hmm.
and you are doing haphazardly occlusal adjustment
Okay, sir.
without understanding the periodontal concept, you will create a unsatisfactory result, and you will say this occlusal adjustment doesn't give the result. It is uncertain. It's illogical.
Mm-hmm.
So you will keep on spreading the wrong notion that there is no advantage of doing, because you have failed to identify the proper cause of the problem.
अच्छा सर, ये prosthodontic occlusion and orthodontic occlusion?
Occlusion in the normal mouth is the orthodontic proper alignment of the normal teeth,
Mm-hmm.
proper interrelationship between upper and lower arch in the normal teeth.
Okay,
In
sir.
the mouth
Mm-hmm.
is the orthodontic, and prosthodontic is in the denture.
Okay.
Occlusion in the denture. So what we say, orthodontic occlusion is not the prosthodontic occlusion.
Okay, sir.
Okay, the concept of orthodontic occlusion is different than the concept of prosthodontic occlusion.
Okay, sir.
In prosthodontic, we tend to see the beauty, aesthetic part, retention part.
Mm-hmm.
Okay,
Okay, sir.
so whenever we reduce the occlusal prematurity, we see that denture should be retained. It should not be dislodged. That was our aim, and it should be more and more aesthetic.
Okay, sir.
While in orthodontic,
Mm-hmm.
we have different need.
Which need, sir?
Masticated need.
Okay.
Masticated need is far most important than aesthetic needs. In order to harness the aesthetic need, we cannot jeopardize the masticated need, because it is a healthy mouth.
Okay, sir.
You can't improve the aesthetic need as per your concept when he is having no problem. Mastication. Patient has to say, okay, I want this canine this side or that side.
Okay, sir.
So in your concept, if it is adding to his masticatory need, then you can do it.
Okay, sir.
Otherwise, it is wrong to do the orthodontic treatment.
Thank you, sir, for your information.